pretty neat to make the pocket.
And down here, 3.
So that way it'll pucker up and then she could just... Gotcha.
Alright. Are you taking a video?
Yeah.
I have dreams about doing the shape biopsies, and it's like there's an end that I don't get, and then I go back and get a little more, and I get a little more, and I get a little more, and then there's this big
Nothing?
big open area on somebody's back or something. Yeah.
That's pretty neat how that works.
Yeah, with the shape, you can do a lot of different stuff because you can go deep and scoop and push, or you can go broad and flat. So you can do a lot of different things.
That was the central.
Correct. Yes.
Yeah, he's always curious. To see.
And it's just amazing that people you can't feel it and how good the lidocaine is.
Well, I'm surprised you're just taking it off to the straight grade.
Not I'll take a little press off.
That's pretty neat.
You can, like I said, you can do a lot of stuff with them because you can go broad and flat, and shallow, or you can just, by angling it, you can go deeper, and I can do something that's a scoop.
Is that just regular Vaseline?
This is aluminum chloride. It's an astringent. It's a drying agent. We actually use it as a deodorant. But it stops, we use it to stop bleeding.
Oh, that's pretty neat.
Alright, let me go ahead and put Band-Aids on those, and then I'll do the one on the, have you lean back and put one on the forehead. This is the Vaseline. Okay.
What about the ones that you cut off that are puckered up and have that pussy stuff? That's okay.
This one?
Uh-huh.
And then, yep, they're good. To me, they're dry. If they're wet like that, I worry about secondary infection. It's normal for them to have a rim of red around it, but the red doesn't come out here. That's the first sign of infection. Okay. So these are going to heal in and heal up, and the 2 that I just did are going to do the same thing. Okay. It may take a couple weeks. Everybody wants to be better in a week or 2 or 3, but it really takes so the rest are looking fine. And I know you got some scratches up here too from itching, but we're going to work on making you less itchy also, and that'll clear things up a little bit too. Yeah. So there's once, like I said, once you've had one, the risk is not so much that the one comes back, but that you develop another one because you kind of reached that cumulative dose of some exposure that you've gotten one, you can get others. So we're always looking at to find another one. Some people develop one, and other people just get one. You know what I mean? So there's no predicting. So we're just always watching for it. So you may have another, but there's nothing else there now that I think is suspicious or worrisome. The scar outcome, one of the hardest places is the back, especially because it's tight, and every time you move this way, it kind of pulls on it. So we're going to do certain stitches they go underneath the skin that take a while to dissolve, so they hold that together. And then certain stitches on top that I'm going to run a little bit so that you don't get that track marking from them. Okay. So Jill's going to get you gnomed up, and that's the size of it. Can you see the outline?
Yeah, that's not that bad. Not that bad.
No, it's small actually.
That's good. Not compared to the other videos I've seen.
Alright. So I'll poke. 1, 2, 3. Take a big breath. This is going to get poofy again.
Sort of how one of the ways that it numbs the skin is it lifts that top layer away from.
I would have never thought that was basal. Comparing to the others, it seemed to me like it was all the same. What do they call that change?
It's lidocaine with epinephrine.
Oh,
1% lidocaine. And it's buffered a little bit with some sodium bicarb to take a little bit of the sting out of it, believe it or not, because it's worse without it. Still pretty stingy though.
nah, you've been getting hit by yellow flies.
Yeah, they are something, aren't they?
They're terrible.
That's how I explain what this stuff is like. It's happening to an insect with a yellow fly or a mosquito. Jump on you and bite you and you can't get it off. That's the aggravation of it. Not quite like a yellow fly, but maybe like a mosquito. That's it?
Almost. I'm going to do just one more injection, kind of deeper.
Put in as much as you like.
Oh, are you going to go that route again, huh?
What?
Go ahead and get them all while you can.
That's right.
And he got messed up. I think I did a little bit too much. Yeah, I think you did.
Are you feeling that go in?
Yeah.
Okay.
Go ahead. It's there now.
Does it pokies?
Yeah, get it.
Breathe in. He has a habit of
Holding the breath.
mm-hmm.
Yeah.
Just when he goes sleep time.
EMTs.
Yeah, they use pretty.
Explain to me what I was doing.
I'm going to do a little test here. Okay. You'll feel pressure, but any sharp pain through here? How about down here?
Feel you do it. I feel you there.
Yeah, but not like this.
No.
That's comparative.
I like that.
Good.
How about over here? Anything sharp?
That's the husband test. You feel this? Nope. How about this?
Yeah.
All right. I'm going to get you into a position that hopefully is both comfortable for you and that was comfortable for us too.
Alright. You did good. Proud of you. You did a good job. I'm not gonna show hardly nothing in there. Are you worried about messing up your girlish figure?
Just don't want any more coming up my way.
GQ magazine.
This is
Do you want to sit up? It might be easier. I mean, because that's going to be a position you're in more often than with your arms like that for me putting the bandage on.
what's easiest for you?
It's probably if you're sitting up. Mastazole. It's an adhesive. We're going to be putting some little steri strips on this.
Okay.
Those will stay on. You won't take them off until the sutures come out. Okay.
How long is that going to take?
About 2 weeks. It's usually 10 to 14 days, usually on the back. So what you're going to do, you'll be going home today with a big thick bandage on here. But when you take that top bandage off, you're going to see these strips underneath.
I don't have to move around today.
Oh no. This is what those look like. That's
Okay.
going to be along the top of your wound on your back. And you're just going to leave those on. You can get these wet in the shower. If you notice that the edges are kind of peeling up or something, you can trim them. If they fall off, it's not the end of the world, but usually they stay on. So today is Tuesday, so Thursday morning, you can take the top bandaging off. You'll leave the steri strips on, get in the shower, let the water run over it to clean it off. And that is it. No more Vaseline or ointment or anything on this, okay?
The whole thing? That's it. That's everything.
Now, what did it look like before you started cutting it? Oh, well, she's got the picture, right?
Mm-hmm.
You've already taken the biopsy of it, so you already cut it.
Right. Yeah, it's the.
You can't really.
That's the whole.
You're kidding. That came out of me?
Mm-hmm.
Wow.
It was like an alien.
Yeah, but like could have had freaks here, too.
3 years. All right, so there's written instructions here as well on how to take care of this. If you have any questions or problems or don't feel like something's right, so you can't drive on it. It's the same as drinking and driving. And so it's, if you need it, it's what means you probably should be at home. And alcohol plus narcotic, 1 + 1 = 3. You know, they both kind of leap up. So, but if you need it, you need it. A lot of times when you need it, it's the first night, you know, and trying to sleep. And some people need it, some people don't. But if you need it and it's midnight, you'll be glad that you have it. Okay. And do you have a clean care sheet about how to take care of it? Okay. And do you have any questions for me? The front desk is going to make you a follow-up appointment for about 10 days. We'll take the stitches out and take a look. If you have any concerns about anything beforehand, about how it's healing, if you think something's not right, all you have to do is give us a call. Since it's covered in steri strips, it's hard to see. But again, the pain should get better. It's always worse the first night, and then it wears off when you're trying to sleep. If that ever goes backwards and it hurts more, you know, and it's not because you didn't just bang on something that you forgot about or move a certain way, then I want you to give me a call. It should not get ever more painful. If it does, if it was healing and getting better every day, and you go backwards and it's more painful, then you're worried about an infection or bleeding underneath the skin. And it's always easier to check and fix something early, so if something's not right, just call.
So they're going to do biopsy on all that they just cut off, right?
They did. They're going to look at all of that. We sent the whole piece to the pathologist, put it in little slices, and check the edges and the depth to make sure that's all right.
And how long will it take for us to find out about that one?
It's usually about 10 days, so kind of about the same as when we called you before. And we'll call if sometimes they get it in the morning when you come in for the suture removal, you know, or sometimes they get it the afternoon after you leave too. But if we have it beforehand, we'll always call.
Vas a olvidar. Yo he tenido tanto temor. ¿Para qué vas a olvidar?